These resources are so available. It's just people need to get over the stigmas that associate with HIV and really understand that everybody's at risk regardless of what you identify as. What made me essentially narrow my advocacy is this necessity to make sure that everybody knows who's at risk, why Black people are even more at risk than other races, especially the white counterparts, and what can you do in order to prevent you from contracting this disease. Sort of harkens back to the lack of resources and the lack of education that communities of color do not necessarily get exposed to while they're in high school and while in their formative years. We still have young people contracting HIV and AIDS on a global scale, not just in the United States. And it really helps to become aware of the risk factors, but it also helps to know what you can do in order to make sure that your loved ones or yourself is protected. Make sure and advocate, and push legislators to stop banning books, for instance, that deal with LGBT identities. Push for equality measures across the country and across the globe. And you see these poor communities of color that don't have resources, don't have access to PrEP, don't have access to any sort of like preventative measures. And so that's why the work that Advocates for Youth does and Youth Resource does is really important, because it gives kids an opportunity to be exposed to the education that I wish I had growing up. And it gives kids an opportunity to say, hey, it's okay to be gay as long as you can protect yourself and as long as you can have access to PrEP and as long as you know your actions will determine whether you get HIV or not. With PrEP, we have experienced a turnaround when it comes to HIV, the HIV pandemic. It's still a pandemic, but with the advent of PrEP, it has essentially turned the tides fighting against HIV. It currently costs as much as $13,000 a year without insurance. I don't know about you, but I don't have $13,000 out of pocket. Most insurance plans do cover Truvada, which is PrEP, but you'd still have to pay like a copay that most people can't really afford. If they got that access to PrEP, that would increase my hope for the future for the Black community tremendously. All of it happens through a culturally responsive and sex positive lens. And so Get Your Life addresses topics like HIV, YMSM, young men who have sex with men, cultural and social norms surrounding that, relationship dynamics, and the impact of racism and homophobia, along with HIV and STI risk. So it's really an inclusive educational resource for teenagers who identify as LGBTQ and those who identify with communities of color to actually get informed and be encouraged to practice preventative measures. People need to get over the stigmas that associate with HIV and really understand that everybody's at risk regardless of what you identify as.